Numbers from the CDC finds autism and developmental disabilities are on the rise. A doctor who specializes in this field says those patients face a serious gap in healthcare services.
Our Bill O'Neill joins us in Greensboro now with the story.
The gap is reportedly a lack of training. Medical students spend years training to become doctors, but Dr. Craig Escudé says there is no curriculum on how to spot or communicate with people who are diagnosed with intellectual or developmental disabilities.
The first thing is awareness, including awareness of healthcare providers about the need to learn about healthcare for people with intellectual and developmental disabilities.
Dr. Craig Escudé says that healthcare education hasn't caught up with the rising number of IDD diagnoses. According to the CDC, 1 in 36 children are now identified with autism, and 1 in 6 children are diagnosed with a developmental disability. Dr. Escudé says that when healthcare providers don't recognize changes in their patients' behavior, early signs of trouble are often missed.
And this is a term called diagnostic overshadowing, where early signs and symptoms of something are just attributed to the person's overall condition, such as their intellectual disability, rather than looking for a treatable underlying condition.
Dr. Escudé says the problem is that medical schools don't include training on how to identify or communicate with patients who are intellectually or developmentally disabled.
Well, I can speak from my own personal experience as a family physician. I had no training in medical school or residency about how to provide good health care for people with IDD.
Dr. Escudé says there are studies showing that many clinicians feel uncomfortable and incapable of providing the same level of health care to people with disabilities as those without. In Greensboro, Bill O'Neill, WXII 12 News.